So when I heard that MedGlobal was interested in doing a little bit of antenatal work and they wanted to bring ultrasound training for mid-level providers and basic ultrasound training to our health workers, what was really interesting to me was that they have this ultrasound training is point of care. So as part of the training, they're training our providers on using the butterfly ultrasound, which is it has a robust, which is a rapid obstetric ultrasound mechanism. So, and the butterfly it's a really wonderful machine, and it's really great that we've been able to use it for our providers, because we'll be getting a few after this training that will be going to our outreach sites. Most of the maternal health work that I'm looking at is outside of Karachi, and the main site that I'm looking at is in Bhong, which is where we run a midwife-led labor room. And a lot of the people that come in, the first time we come in, they don't know much about their pregnancy. They haven't been able to see a provider because of distance, because of access. And the first time they come in, a lot of things about their pregnancy are big question marks. You know, how far along are they? Is it even safe to deliver at this facility? Is the baby safe? Does this baby have a heartbeat? And I think one of the things that come up every single time I talk to these midwives is, what do we do about all these unknowns? So this was something that they have told me before I knew that this could even happen. They told me that if there was ever a chance to have a machine and to be able to do ultrasound, we would love to get out of that region of unknowns and know what it is that we're dealing with. So far this training has been pretty useful. We're on our second batch now. The first batch was very happy. They've learned a lot about ultrasound. The machine is also very easy to use, so it's been very easy for them to pick up. So we have a mix of midwives, we have some obstetricians who work in remote areas, we have some obstetricians who work in Karachi, and all of them are working towards the same thing, and it's been pretty useful for them, and you know, they've learned a lot, and they've gone back and they're getting really excited to start using this, whatever they've learned in their facilities.
Assalamualaikum. My name is Dr. Sada Flody, and I'm from New York in the United States. And I'm with the group on point of care ultrasound for OB, obstetrical ultrasound. So what we're teaching today and over the course of the 3 days is obstetric emergencies. We go over preeclampsia, we go over shoulder dystocia, postpartum hemorrhage, sepsis. Okay, then we do some obstetrical drills. So for example, we go over a drill on postpartum hemorrhage and on shoulder dystocia. Then we went and we talked about incomplete abortions and miscarriages that people have, and how you can manage that in a clinical setting. Day 2 and day 3 is very heavy in obstetrical ultrasound, and we have participants that come in from the clinic here at the hospital, and they come in and they allow us to do an ultrasound on them, and thereby giving the participants more experience. And what's been great about it here is that we've had lots of participants, lots of ladies wanting to see their baby on ultrasound, and allowing us to examine them and take a look at the baby, at the placenta, at the fluid, and all the things that we wanted them to get more experience on.
मेरा नाम यास्मीन यासीन है और मैं भोंग से आई हूँ। इंडस हॉस्पिटल में जॉब करती हूँ और हम लोग गायनी डिपार्टमेंट को चला रहे हैं। और जब हम यहाँ पे ट्रेनिंग के लिए आए हैं तो हमें बहुत अच्छा लगा है और यहाँ से बहुत कुछ सीखने को मिला है, और इंशाल्लाह जो सीख के जाएंगे इंशाल्लाह वहाँ पे पेशेंट पे अप्लाई करेंगे।